Let's see, section 9.4, disorders of the spinal cord and peripheral nerves. Disorders of the myelin sheath of nerve fibers. There are many disorders of the nervous system that affect the spinal cord and the peripheral nerves without affecting the brain. When the myelin sheath surrounding nerve fibers is damaged, nerves do not conduct impulses normally. Demyelination, the destruction of an area of the myelin sheath, can occur in the peripheral nerve system caused by inflammation, vitamin B12 deficiency, poisons, and some medications. Guillain-Barré syndrome is a disorder of the peripheral nerves in which the body makes antibodies against myelin, leading to loss of nerve conduction, muscle weakness, and paresthesias, changes in sensation. Treatment is with corticosteroids, and recovery of neurologic function is slow. Demyelination of nerve fibers in the brain, spinal cord, and optic nerves also can occur. Multiple sclerosis, MS, is a chronic progressive disorder and the most common of the demyelination disorders. Multiple sclerosis is a chronic progressive disorder. Intermittent myelin damage and scarring slow nerve impulses. This leads to muscle weakness, pain, numbness, and vision loss. Because different nerve fibers are affected at different times, multiple sclerosis symptoms often worsen, exacerbations, or show partial or complete remissions. Muscular sclerosis has an average age of onset between 18 and 35 and is more common in women. Its cause is unknown, but it is thought to be an autoimmune disease. Multiple sclerosis, note areas of the spinal cord where myelin sheath has been destroyed. Normal spinal cord is yellow. Other causes of demyelination in the central nervous system are injury, ischemia, toxic agents such as chemotherapy or radiotherapy, and congenital disorders such as Tay-Sachs disease. Tay-Sachs is a rare genetic condition caused by the absence of an enzyme that breaks down fatty substances, causing a buildup of fats in neurons in the brain, resulting in damage in the brain tissue. The most common form has onset in infancy but can appear in children and adults. Infantile signs include blindness, sensitivity to sound, hypotonia, and seizures. After viral infections or vaccinations, post-infectious encephalomyelitis is a demyelination process, as is HIV encephalitis, which is seen in up to 30% of patients with age. Demyelination. Ation is process, D away from or without, and myelin is myelin. Process of losing the myelin sheath of a nerve fiber. Encephalitis. Encephal means brain. Itis is inflammation. So inflammation of brain cells and tissues.
Encephalomyelitis.
Encephalomyelitis. Myel is spinal cord, encephalo brain, itis inflammation. So inflammation of the brain and spinal cord. Exacerbation or contrast remission. Exacerb is increase or aggravate. Ation is process A period where there's an increase in the severity of a disease.
Guillain-Barré syndrome.
Guillain-Barré syndrome, named after George Guillain, lived 1876 to 1961. And Jean-Alexandre Barré lived 1880 to 1967. He's a French neurologist. Okay, Guillain-Barré syndrome. Disorder in which the body makes antibodies against myelin, disrupting nerve conduction. Intermittent, inter between, mit is send, and int is end result. Alternately ceasing and beginning again. Paresthesia and paras abnormal. Esis is a sensation or feeling. Ia is condition. Abnormal sensation, for example, tingling, burning, or prickling. And paresthesias is plural for paresthesia. Remission, contrast, exacerbation. So Ian is an action condition, re is back, miss is sent. Period when there is a lessening or absence of the symptoms of a disease. Tay-Sachs disease, Warren Tay, born 1843 to 1927, English ophthalmologist, and Bernard Sachs, 1858-1944, an American neurologist. Hi, Sweet Pea. How you doing? So Tay-Sachs disease is disease in which fat buildup in neurons of the brain and spinal cord, causing their destruction. Disorders of the spinal cord, trauma. Approximately 500,000 people in the United States have spinal injuries, SCIs. About 17,000 new injuries occur each year. 80% involve males. Quadriplegia is slightly more common than paraplegia. PPS is rarely life-threatening. And the severity of residual weakness and disability relates to the severity of the original acute poliomyelitis. Because of its anatomy with nerve fibers and tracts, it's code. Because of its anatomy with nerve fibers and tracts going up and down to and from the brain, injury to the spinal cord results in loss of function below the injury. For example, if the cord is injured in the thoracic region, the arms function normally, but the legs can be paralyzed. Both muscle control and sensation are lost. The spinal cord is injured in 3 ways. 1, severed. If the spinal cord is severed, the loss is permanent. Contusions can cause temporary loss lasting days, weeks, or months. And 3, the spinal cord can acutely become compressed by a broken or dislocated vertebra, bleeding or swelling. In an acute injury, the first goal of treatment is to prevent further damage, which is why you see football players being carried off the field, strapped to a board, and carefully padded to prevent even slight slight shifting of the spine. Compression of the cord can also occur slowly from a tumor in the cord or spine and can also be due to a herniated disc. Cancer or osteoporosis can cause a vertebra to collapse and compress the cord. Cervical spondylosis is a disorder in which the discs and vertebrae in the neck degenerate narrow the spinal canal and compress the spinal cord and or the spinal nerve roots. In syringomyelia, fluid-filled cavities grow in the spinal cord and compress nerves that detect pain and temperature. There is no specific cure. Other disorders. Acute transverse myelitis is a localized disorder of the spinal cord that blocks transmission of impulses up and down the spinal cord. People who have Lyme disease, syphilis, or tuberculosis, or those who inject heroin or emetaphenes intravenously are at risk of developing this disorder. The disorder causes loss of sensation, muscle paralysis, and loss of bladder and bowel control. There is no specific treatment. Most people never completely recover. A subacute combined degeneration of the spinal cord is due to a deficiency of vitamin B12. The sensory nerve fibers in the spinal cord degenerate, producing weakness, clumsiness, tingling, and loss of the position sense as to where limbs are. Treatment is injections of vitamin B12. Poliomyelitis. Polio is an acute infectious disease occurring mostly in children that is caused by the poliovirus. The virus can be asymptomatic in the nasopharynx and gastrointestinal GI tract. When it spreads to the nervous system, it replicates in the spine cord and destroys motor neurons. Symptoms are progressive muscle paralysis. Poliomyelitis is preventable by vaccination and has almost been eradicated in the world. Post-polio syndrome, PPS, in which people develop tired, painful, and weak muscles many years after recovery from polio, is classified as a motor neuron disorder. Motor neuron disorders occur when motor nerves in the spinal cord and brain progressively deteriorate. This leads to muscle weakness that can progress to paralysis. Amyotrophic lateral sclerosis, ALS, or Lou Gehrig disease and its variants, progressive muscular atrophy, and primary lateral sclerosis are examples. There is no cure. Acute, Latin for sharp, having a rapid onset and duration. Amyotrophic, pertaining to muscular atrophy. Myo is muscle, troph is nourishment and development. A is without, and ic is pertaining to. Atrophy, A without, trophy, nourishment or development. Wasting or diminished volume of a tissue or organ. Compression, Eon is action, calm is together, and press is squeeze. Compression, a squeezing together so as to increase density and or decrease a dimension of a structure. A hernia is Latin for rupture. Hernia is rupture, so protrusion of a structure through the tissue that normally contains it. Herniation is rupturation is process. It's a protrusion of an anatomical structure from its normal location. And herniate is composed of hernia's rupture is to protrude. Lyme disease, named in 1977 after a group of children in Lyme, Connecticut who acquired the disease. A disease transmitted by the bite of an infected deer tick. Myelitis, myel, spinal cord, itis, inflammation of the spinal cord. Paralyze, para is abnormal, lies is destroy. To make incapable of movement. Paralysis, lysis, destruction, para abnormal. A loss of voluntary movement, and paralytic is pertaining to or suffering from paralysis. Poliomyelitis. Polo is gray matter, myel is spinal cord, itis inflammation. Inflammation of the gray matter of the spinal cord, leading to paralysis of the limbs and muscles of respiration. Post-polio syndrome, progressive muscle weakness in a person previously affected by polio. Spondylosis is a spondyle is vertebra and osseous condition, degenerative osteoarthritis of the spine. A subacute, a sub underneath, below, slightly under. Okay, Latin for shark. A subacute is less than rapid onset and duration of a condition, but not a long-term disease.
Syringomyelia.
Syringomyelia. Syringo meaning tube or pipe, myel meaning spinal cord, ES condition. Abnormal longitudinal cavities in the spinal cord that cause paresthesias and muscle weakness. Disorders of the peripheral nerves. The term neuropathy is used here as any disorder affecting one or more peripheral nerves. Mononeuropathy is damage to a single peripheral nerve. Prolonged pressure on a nerve that runs close to the surface over a bony prominence is a common cause. Examples are carpal tunnel syndrome. The meridian nerve at the wrist is compressed between the wrist bones and a strong overlying ligament. Numbness, pain, and tingling of the thumb side of the hand are the symptoms. Incision of the ligament receives the pressure. Incision of the ligament relieves the pressure. Ulnar nerve palsy. Nerve damage occurs as the ulnar nerve crosses too close to the surface over the humerus at the back of the elbow. Pins and needle sensation and weakness in the hand result. Hitting the ulnar nerve is the cause of pain when you hit your funny bone. Peroneal nerve palsy. Nerve damage occurs as the peroneal nerve passes too close to the surface near the back of the knee. Compression of the nerve occurs in people who are bedridden or strapped in a wheelchair. Herpes zoster occurs in people with depressed immune responses, HIV infection or cancer, and those on chemotherapy and or radiation therapy, as well as for no apparent reason. Polyneuropathy is damage to and the simultaneous malfunction of many peripheral nerves throughout the body. Symptoms of acute polyneuropathy include muscle weakness and a pins and needles sensation or loss of sensation. The symptoms begin suddenly in the legs and work upward to the arms. In diabetic chronic polyneuropathy, only sensation is affected, most commonly in the feet. Pins and needles, numbness, and a burning sensation are prominent. When people with a neuropathy are unable to sense pain, they can injure a joint many times without feeling it. The joint malfunctions and can progress to being permanently destroyed. Joints involved in this neuropathic joint disease is called Charcot joints or Charcot joints, CHARCOT. Herpes zoster shingles is an infection of peripheral nerves arising from a reactivation of the primary virus infection in childhood with chickenpox or varicella. During the painful infection of chickenpox, the virus gains entry into the sensory dorsal root ganglia. Later in life, for unknown reasons, the virus can produce the painful unilateral dermatome rash of shingles. We have post Thoracic neuralgia is an acute dermatome pain persisting after the acute rash of shingles has subsided. It is debilitating and very difficult to treat. Neuromuscular junction disorders occur where nerves connect with muscle fibers and interfere with the neurotransmitter acetylcholine. Examples are myasthenia gravis, in which the immune system produces antibodies that attack acetylcholine receptors on the muscle cells. And common symptoms are drooping eyelids, weak eye muscles causing double vision, difficulty talking and swallowing, and muscle weakness in the limbs. Botulism, a rare life-threatening food poisoning caused by toxins from the bacterium Clostridium botulinum. The neurotoxins paralyze the muscles. Botulism can develop from ingesting food containing the toxin from a wound infected with Clostridium botulinum. Certain insecticides, organophosphates, and nerve gases in a chemical warfare that act on neuromuscular junctions. Nerve compression occurring when the space around the nerve is constricted. The pinched nerve becomes edematous and later fibrotic and produces pain and paresthesias. Examples are sciatica, when the sciatic nerve is compressed in the lower spine, and carpal tunnel syndrome, when the median nerve is compressed at the wrist. All right, botulism, Latin for sausage, caused by the neurotoxin produced by Clostridium botulinum. Carpal, carp is wrist. Al is pertaining to the wrist. Carpal tunnel syndrome, tunnel, English for tube or pipe. Sin is together, and drum, running. So compression of the meridian nerve in the wrist, causing numbness, pain, and tingling in the fingers and thumb. Okay, Charcot joint, named from Jean Martin Charcot, 1825 to 1893, French neurologist. Bone and joint destruction secondary to a neuropathy and loss of sensation. Chickenpox, disease originally considered a chicken, not dangerous version of smallpox. Acute contagious viral disease, also known as varicella. Clostridium botulinum, bacterium that causes botulism. Herpes zoster shingles, herpes Greek for spreading skin eruption, zoster is Greek for girdle. Painful eruption of vesicles that follows a dermatome or a nerve root on one side of the body. Myasthenia gravis, my is muscle, is without, sthene is strength, gravis is serious, and E is a condition. Disorder of fluctuating muscle weakness. Neuralgia, nerve, algia is pain. All right, neuralgia is pain in the distribution of a nerve. Neuromuscular, pertaining to both nerves and muscles. Neuropathy, any disease of the nervous system. Neuropathic, pertaining to a disease of the nervous system. Mononeuropathy, disorder affecting a single nerve. And polyneuropathy, disorder affecting many nerves. Neurotoxin, agent that poisons the nervous system. Perennial, pertaining to the lateral part, fibula, of the lower leg, or the nerve named after it. Peron means fibula. All right, post-therapeutic. No, that's not what it says. It says
Post-herpetic.
Post-herpetic, very different, pertaining to after herpes infections, because herpet is herpes. Sciatica, Greek, related to the hip joint. Sciatic is the adjective for sciatica. Sciatica, pain from compression of L5 or S1 nerve roots. And sciatic is pertaining to the sciatic nerve or sciatica. Ulnar, ulna, or uln meaning ulna, and R pertaining to the ulna, the medial forearm bone, or any of the structures, artery, vein, nerve named after it. Varicella, Latin for a tiny spot, an acute infectious disease called the varicella zoster virus. It's kind of sad. This is a newborn with anencephaly. And this is the shingles. This is... Oh, we've seen that the spine. Where's the one? Oh, it's in the next one, I believe, the disorders. It shows other stuff. Okay. All right, here. Fetal alcohol syndrome. Infant with hydrocephalus. Okay. Congenital anomalies of the nervous system. Some of the most devastating congenital neurologic anomalies develop in the first 8 to 10 weeks of gestation, when the nervous system is in its early stages of formation. These malformations can be detected by using an ultrasonography and amniocentesis. Many can be prevented by the mother taking 4 milligrams a day of folic acid before conception and during early pregnancy. A teratogen is an agent that can cause malformations of an embryo or fetus. It can be a chemical virus, or radiation. Some teratogens are encountered in the workplace and include textile dyes, photographic chemicals, semiconductor materials, lead, mercury, and cadmium. One of the early uses of the drug thalidomide was to control morning sickness in pregnancy, but it caused severe limb and other deformities in the baby. Okay. Anencephaly is absence of the cerebral hemispheres and is always fatal, like that picture from earlier. Microcephaly, decreased head size, is associated with the small cerebral hemispheres and with moderate to severe motor and intellectual disability. One cause of microcephaly is an infection during pregnancy with the Zika virus. This virus is carried by an aggressive mosquito that can bite in the daytime or at night, and also can be passed from an infected person to another person during sex. Hydrocephalus, ventricular enlargement in the cerebral hemispheres with excessive CSF. Oh my goodness. Is usually due to an obstruction that prevents the CSF from exiting the ventricles to circulate around the spinal cord. Wow. Fetal alcohol syndrome, FAS, can occur when a pregnant woman drinks alcohol. A child born with FAS has a small head, narrow eyes, and a flat face and nose. Intellect and growth are impaired. Fetal alcohol syndrome is a cause of intellectual disability. Spina bifida occulta, small particle defect in the vertebral arch. The spinal cord or meninges do not protrude. Often, the only sign is a tuft of hair on the skin overlying the defect. And spina bifida cystica, no vertebral arches form. The spinal cord and meninges protrude through the opening and may or may not be covered with a thin layer of skin. Meningocele, protrusion of the meninges only. Meningomyositis cellosal, protrusion of the meninges and spinal cord. Paralysis of the lower limbs may be present. The defect must be closed promptly to preserve spinal cord function and prevent infection. The cause of spina bifida is not known. Anencephaly without encephal brain and its condition. Born without cerebral hemispheres. Anomaly, Greek for abnormality, a structural abnormality. Hydrocephalus, hydros water, cephal head. This is pertaining to enlarged head due to excess CSF in the cerebral ventricles. Meningocele, meninge is your meninges, and cele is a hernia. Protrusion of the meninges from the spinal cord or brain through a defect in the vertebral column or cranium.
Meningomyelocele.
Meningomyelocele is protrusion of the spinal cord and meninges through a defect in the vertebral arch of one or more vertebrae. Microcephaly, cephal's head, microsmall. An abnormally small head. Spina bifida, a failure of one or more vertebral arches to close during fetal development. Spina bifida cystica, meninges and spinal cord protrude through the absent vertebral arch and have the appearance of a cyst. Spina bifida occulta, the deformity of the vertebral arch is not apparent from the skin surface. Okay. Teratogen, agent that produces fetal deformities. Terato means monster, malformed fetus. Gen is produce and create. And teratogenic, an adjective, has two suffixes, capable of producing fetal deformities.